Medical Center must be registered as an applicant organization in grants.gov and ERA Commons before any proposals can be submitted. Next slide, please. So we have a brand new waiver that has been communicated to the field from ORP. So this is an enrollment of non-veterans in ORD funded research. This is required for all projects with non-veterans. And we did confirm this week that there are no exemptions. For example, if an investigator is enrolling VA employees, some of whom may be providers, this waiver requirement would apply to them as well. Even though they're affiliated with VA as a targeted group, they may have a few of them who are themselves veterans, but if the majority of the people in the targeted group are non-veterans, then this waiver will be required. So we have some published handbooks available on the ORD website that has more information about waivers. The non-veteran enrollment waiver is discussed in VHA Directive 1200.01. The eligibility waiver is in Program Guide 1200.15, and the offsite waiver is in Program Guide 1200.16. So we have a number of different waiver categories. They include offsite research, exceeding duration or budget cap, inclusion of videos, PI eligibility, enrollment of non-veterans, resubmissions. And what this means, a resubmission, is that, for example, for an IIR, generally we allow 3 submissions, an initial and 2. If there's a compelling reason why a PI feels he or she should be allowed to submit a 4th, then they would need a waiver in order to do that. And exceeding IPA percentage of budget. The deadline for all of the waiver requests is May 14th, 2021. And it's important to remember that a copy of waiver approval letters from HSR&D must be included in the letters of support section of the application. Missing letters are considered fatal. Thank you. I'll turn it back over to Kathy.
Thank you, Liza. So in the next slide, it's on intent to submit. All HSR&D applications require an intent to submit to be eligible for review. The intent to submit is done through the ART website, and there's a window for our application ITS that is April 23rd to May 7th. If you are submitting for a mentored award for the CDA or the HBCU Scientists Award, those require also a letter of intent. And the letter of intent are sent to Rob Small, and those are reviewed. If the letter of intent is approved, you can submit an ITS, or if it is under review. But ITS are required for all applications for submissions. If you are submitting to a QUERI project, the ITS window is April 1st to May 17th. Next slide, please. All of our HSR&D applications have a required abstract format that we need. They include the background, significance, innovation and impact, specific aims and methodology, and next steps. It's really important for you to follow this format. We expect all applications to follow the directions and the templates that are indicated in the RFAs. Next step. Next, please. Some notable sections in our RFAs include patient experience and veteran engagement. Most of patient experience and veteran engagement is an important component of health services research, and we anticipate that applicants should seek input from their patients and veterans in designing their studies. One of our project's largest problem is with clinical trial recruitment, and this is frequently an issue. So when you are designing a tryout, please consider your study population carefully and your calculations. Be careful, carefully explain how you derive your estimates. Check on competing studies for that population at the sites that you are intending, and propose some mitigation strategies if there are recruitment lags. Regardless, we want to see Plan B for recruiting. Next slide, please. RFA also requires an implementation and dissemination plan. We don't want to fund research for the sake of research. We want your work to have a significant impact on the lives of our veterans. So we want your applications to discuss what the next steps are in the once that project is completed, and what's the path making a difference in care. We want to know who's going to own this problem at the end of the study, and what are those barriers to getting this innovation out into the field. You know, we want these studies to compress the cycle of understanding, and we want to be able to scale these interventions. Next slide, please. So for the Parent Merit Review Award, this is for $1.2 million and a maximum of 4 years. We have the priority areas that should be considered in developing your applications. These are, Naomi went into some detail about these, and you can also access the priority domains at the site listed here. Next slide, please. So we also have pilots. Pilots are for $200,000 and up to 18 months, and we allow 1 resubmission for pilots. Next slide, please. Pilot goals and next steps need to be very clear. We want a pilot goal could be to establish components of interventions, to seek non-statistical information about the optimal sources of subjects, recruitment techniques, estimates of yields, establishing levels of interest or feasibility of completing the measurements that are proposed. A goal could be to establish cross-disciplinary collaborations or to test novel methods to support that cross-disciplinary research. They could support a small innovative study that does not necessarily lead to a merit award, or they can be to conduct preliminary analysis of existing data to refine populations or inform intervention development or establish feasibility. But whatever the goals is that is clearly defined, these methods need to align with those goals and be appropriate for a pilot work. Next slide, please. For the targeted suicide, we have 2 mechanisms. One is the merit, which is 1.2 for 4 years, and now the 200,000 for 18 months. The targeted suicide focuses on observational studies, effectiveness studies, implementation, including hybrid studies, or population-based and community-level studies that advance prevention of suicide among veterans. Next slide. The emphasis is on veteran groups that are at high risk for suicide and other risky behaviors. One new area that we have added is that veterans recently experiencing issues related to the social, economic, and psychological impact of COVID-19. These other emphases have remained the same since we've had the targeted suicide prevention. However, they are all extremely important, and we welcome applications in any of these emphasis areas. Let's see. So the next slide, please. So the next RFA is Determinants of Health. Again, this has a merit for 1.2 and 4 years and a pilot for 200 for 18 months. Next slide, please. The Social Determinants of Health RFA was expanded last cycle to include equity, and we encourage investigators to treat equity and social determinants of health as interrelated topics by applying equity lens to social determinants of health research, and by considering social determinants of health when developing approaches to analyze or mitigate racial and ethnic disparities. Some of the equity guidance for applications is listed here. Next slide, please. So for the opioid safety and opioid use disorder, again, we have the two mechanisms of merit and pilot, and the opioid safety and opioid use disorder, we are looking for evidence that will prove useful to the development and evaluation of new and existing evidence-based practices for our various veterans populations. Next slide, please. So the overarching themes of this RFA is to study opioid safety and opioid use disorder management for older veterans, develop and deployment of effective strategies for reducing racial and ethnic disparities in the treatment, and examination of intervention of models of care that can be scaled within the RFA. The goal of these projects should be to promote collaboration with VA partners and produce evidence that will prove useful to the development and evaluation of new and existing evidence-based practices for veterans, patients taking prescription opioids, and those with opioid use disorder. Some of the priorities are listed on the slide. And now Stephanie Guerra is going to discuss the pandemic-related disrupted care and deferred care, our new RFA.
Yes, thanks so much, Kathy. Next slide, please. Oh, this slide, yes. So this is our new RFA for this cycle. The purpose of this RFA is to provide evidence-based information to serve veterans during the ongoing pandemic response and recovery, as well as possible future public health emergencies where care may be reduced or disrupted. So as many of you know, since the start of the pandemic, there's been quite a few excess deaths that have occurred across the country as well as within the VA. And so what we're most interested in is studying the effects of disrupted care and how that's affected both mortality and morbidity, as well as care delivery mechanisms, and take those lessons to improve care moving forward. And so listed here are just some of the study areas that we're most interested in. Like I mentioned, the contribution of disrupted care to specific increases in mortality and adverse health outcomes. We're also interested in examining the quality of care, different types of care delivery mechanisms, and generally figuring out if efforts to mitigate the effects of the pandemic were effective in reducing adverse health impacts. So next slide, please. So unlike the other RFAs here, this one actually does not have a pilot mechanism. There's only one mechanism for funding, and that is up to 2 years, and the budget may not exceed $700,000. And the purpose of this is we want these to be quick projects that will give valuable information to our partners. Some of the goals here are examination of health outcomes, care delivery, and other impacts across vulnerable patient populations and geographic regions. We're also interested, very interested in projects that are developed and conducted in close collaboration with partners. And our ideal projects will actually focus on a suite of related health outcomes in specific care delivery settings rather than one specific health outcome. And we last week had 2 cyber seminars, one on mental health care settings and one on acute and chronic care settings, and the links are here and will be included in the slides after the presentation is over. But you can feel free to look for those on the HSR&D website under Cyber Seminars if you would like more specific information about this new RFA. And thank you. I'll hand it back to Kathy.
Thanks, Stephanie. Okay, on the next slide, we're going to talk about Career Development Awards, our mentored research program. These awards, as I mentioned earlier, require a letter of intent, and which the deadline is April 15th. In addition, they will require an ITS. So there are two pre-steps for the Career Development Award. The Career Development Award offers 5 years of salary support and supplemental support funds of $40,000 per year at coins, or $50,000 per year at facilities not affiliated with coins. The application includes a candidate's training, experience, and research accomplishment section, the career plan, and a mentoring plan. Next slide, please. The HBCU Research Award Training Program is also a mentored award, and it has a similar requirement of a letter of intent and an ITS. In this award, there is a VA primary mentor and an HBCU co-mentor. The nominee has to have attended an HBCU or have a faculty appointment at HBCU. We offer 5 years of salary support and supplemental support, and it follows the CDA-2 application format. Again, like the other CDA that I just discussed, it will require the candidate's training, experience, and research accomplishments, and the career plan and mentoring plan. Next slide, please. So this is the calendar of deadlines for our this round. On April 15th, the CDA letters of intent are due. On April 23rd, our ITS will open, and this is the CDA deadline, ITS deadline. The ITS closes on May 7th. The waiver deadline is May 14th, and grants.gov opens on May 15th. The down to the wire submission is June 8th, and the last submission date is June 10th with verification on June 15th. And we will have the scientific review in August. Next slide. For those that need updates on COVID-19 for consideration in their research, the latest information is posted on the ORD SharePoint site, which is listed here. And if you have questions that are not addressed there, you can send them to the ORD COVID-19 mailbox with the email address there. Next slide, please. If you are interested in a QUERI RFA, their cyber seminar will be on April 13th at 11 a.m. Eastern Time, and the link for registration is listed on this slide. Next slide. Okay, so now we're down to questions. If you have questions that are not answered during this session or one that you think of later, please send it to our Cyber Review mailbox, which is the first email address listed on this slide. If you have questions related to the pandemic-related disrupted and deferred care RFA, we have a special mailbox for that, which is listed here. And then finally, if you want access to our RFAs that have been posted, you can find them at this website here from a VA, from within the VA. So you won't be able to access this site from an academic institution that's not VA. So now, Heidi, do we have any questions?
We do have a few pending questions out here. For the audience, please use the Q&A screen to submit your questions, not the chat screen. I'm sorry, I thought that that had been shut off at the start of the meeting, so please use the Q&A screen to submit your questions, not the chat. The first question that we have here is, are there new, I'm sorry, it's not, I'm having trouble understanding that. Are new BioSketch form in 2021 that should be used this submission cycle? If so, when will it be uploaded?
Heidi, this is Tiffin. And there is not a new BioSketch form. The one that currently is in the package is the one that should be used. I believe it was dated, it's good until 2023 right now. So it's from March 2020 to February 2023. So nothing new, the same one that was from last cycle.
Great, thank you. Is the non-veteran waiver necessary for studies that will enroll both veterans and VA employees?
Hi, this is Liza. Yes, it is, because the employees, most of them will not be veterans. So the waiver would be required for that study.
Is a waiver needed for non-enrolled veterans?
Non-enrolled veterans would not be able to participate in a study. I'm not understanding what they mean by that. If a study is enrolling veterans only, it does not need a waiver. If it's enrolling veterans and non-veterans, for example, employees, which is the original question, it would need a waiver. I mean, we would not be funding studies in VA that did not enroll any veterans. So there should be at least one target group that includes veterans.
Thank you. Can a walk appointment be used in lieu of 5/8 employment?
No, it cannot. Walks do not have any official status in the VA. The 5/8 appointment is necessary to verify that the investigator is actually paid. They need to have a paid appointment. If they don't have at least a 5/8 paid appointment, then they would need to get a waiver. Somebody who is a walk, but who envisions having a 5/8 appointment, let's say if the research is funded, would have to apply for a waiver, and they would have to include the justification that if they were to get funded, their medical center would guarantee giving them a 5/8 appointment.
Thank you. Is there any document which details the guidelines, rationale, policy for submitting a request for a fourth IIR submission?
There is information in our new RFAs, which we did not include in prior RFAs, that discusses when a waiver for fourth submission is required. Ordinarily, we do not allow fourth submissions. It would be a very rare circumstance when we would. So just the fact of submitting a waiver, it's not going to guarantee that you would get that approved and be allowed for a fourth submission. But what is really important is anybody in that situation who did not get funded after a third review and would like to resubmit for a fourth time needs to discuss with the scientific program manager, who is responsible for their prior review, whether or not that's feasible. So they really need to consult with that person. If the scientific program manager is inclined to recommend supporting it, then I would say to go ahead and submit the waiver. Otherwise, probably it's not a good idea to do so. But again, there's information about this in our new RFAs, and if you have questions, reach out to your scientific program manager who worked with the review on the prior submission. Thank you.
Great, thank you. The next question here. Hi, thanks for the seminar. What are some preferred strategies to use to solicit or document veteran engagement?
This is really project specific. A number of projects use veterans to help design their applications. Some have veterans as part of an advisory board, or have veterans participating in some other way. Every project's slightly different, so it's really very project specific. I'm sure that your colleagues have some ideas when you discuss it with them.
Thank you. The Merit RFA highlights that co-Is must be VA. Is that true for CDA mentors?
Can you repeat that one, Heidi?
The Merit RFA highlights that co-Is must be VA. Is that true for CDA mentors?
Liza, do you have a thought on this one?
Yeah, I was hoping Rob might have been in the audience, but I guess not. I think that the primary mentors for CDA need to be VA, but there could be other mentors who are not necessarily VA, but we'll have to consult with our CDA program manager, Rob Small, just to verify that. I don't want to give improper advice to people. I'm not 100% sure, because that is a different, category. Usually the mentors for CDAs are not people that are actually personnel on the research project. So that's different than a co-I who's listed as contributing a % effort to the actual research. So they're two different things, and they're not necessarily the same. But we'll try to verify that for certain and get back to everyone.
Great, thank you. The next question here, the CDA slide said ITS window is April 23rd to May 7th, but the calendar said that April 23rd is the CDA ITS deadline. Can you review how and when ITS for CDAs need to be submitted?
So the ITS for CDA is the same schedule. It's the same window as all of the other application types. Even if the LOI for CDAs has a similar date, they're two different activities. So the ITS date is the same as what we've posted here.
Okay, great, thank you. The next question here. I see the RFA provided more details on what needs included in requests for many of the types of waivers. Thank you. I saw the new requirement for the waiver to exceed the 3 submission policy, but not much detail on what to include in this request. Can you provide more guidance on this?
Okay, as I mentioned earlier, this is something that warrants a discussion with your scientific program manager. That person will be able to give you guidance. I can't really say specifically because that is something that we're going to consider on a case-by-case basis, and what is included in the waiver letter is going to depend on the actual research itself. So unfortunately, I can't really get into more specifics. If that situation applies to someone, I suggest you reach out to your scientific program manager and have a discussion with them, and they can give you the proper recommendations at that point.
Thank you. The next question here, do studies that survey or interview VA providers need a waiver if some providers are not veterans?
Yes, they will need a non-veteran enrollment waiver.
Thank you. The next question here, if there are co-PIs, do both need to have 5/8 appointments?
Yes, they will. Co-PIs, PIs, or co-Is who are site PIs all need to have a 5/8 paid FTE, and if not, they need an eligibility waiver of less than 5/8.
Thank you. The next question here, can you apply for IIR if you've not received funding for a pilot before?
Yes, you can. We don't have a requirement that someone has to have had a pilot in order to apply for an IIR. As long as they meet all of the other investigator eligibility requirements, then they could apply for an IIR.
Thank you. The next question here, for studies that are already funded, does a waiver for non-veterans, VA employees need to be submitted, or does this waiver only apply to newly funded studies?
We think it applies only to newly funded studies, but we had a question about that come up internally earlier today, so we are going to try to verify that with ORPE. I have not seen guidance from them, which indicated we need to go back retroactively for studies that are active to get the non-veteran waiver, but I will verify and we'll let you know.
Thank you. Next question here. For the Career Development Award, if the terminal degree was completed 6 years ago, is there a waiver or option to still apply if the gap is due to health reasons?
We don't generally have a waiver for that, but I would suggest having a discussion with Rob Small, our CDA program manager, to talk that out with him and see what he thinks he could recommend in that situation.
Thank you. The next question here, even if using the same BioSketch form, do any of the BioSketch policy updates, especially to research support and other support from NIH, notice NOT OD 21073, apply for HSR&D applications in this cycle?
I am not aware of that, but what I'm going to get more information on that, and I will let everyone know. If there is a change or something different, we will publicize and let everyone know.
Thank you. That is all of our submitted questions here. Just want to check in with any of our presenters to see if any of you have anything you'd like to add. We've got about 12 minutes left here, so I'm hoping maybe another question or two is being typed in. So just, if anyone has any closing remarks or things you'd like to say while we're waiting to see if we get another question or two.
I'd like to thank everyone for your attendance, and we hope that we've addressed the questions. And if not, please submit your question to the CyReview mailbox. Tiffin, could you move down to that slide again, down at the end, please? Yes. So yeah, send your questions if they've not to the CyReview mailbox, and we will do our best to get them addressed. And I see there's another question here.
Yep. Where do we find guidance for the non-veteran waiver?
Liza?
Okay, for the non-veteran waiver, we have created a template that's pretty self-explanatory that the investigator can complete and submit to our office, and you can send a request for that template to the scientific review mailbox, which is on the slide that you're seeing, the first email address, and Tiffin will provide you with that template.
Great, thank you. It looks like we don't have any other questions coming in. So with that, we can wrap things up for today. I want to thank all of our presenters for taking the time to present today. We really do appreciate all the time that you put into this. For the audience, when we close the session out, you will be prompted with a feedback form. We would appreciate if you would take a few moments to fill that out. Thank you everyone for joining us for today's HSR&D Cyber Seminar, and we look forward to seeing you at a future session. Thank you.